Hi, I'm Martha McKinnon. I am a senior architect and design lead at P+HS, and I'm here with Ben, my colleague at Design and Mental Health.
Hi, I'm Ben Lillywhite, a senior architect at P+HS Architects, and we're really excited to talk to you today about why we're here.
I think designing with people in mind is absolutely a key consideration. I think putting yourself in the shoes of someone that is going to walk that mental health journey um, from the from the entrance, from the door, right through to you get triaged through to the ward. The main entrance, I think, is extremely important because it needs to be clear, it needs to be destigmatized. And I think in terms of starting that journey in a heightened emotional state, you don't want to be anxious, you don't want the wayfinding to be unclear. I think once you move through that entrance and you get to the reception, hopefully it's a bright, airy, light-filled space with a friendly face that meets you. I think, again, given the emotional sort of state that the service user might be in, it's also important to have a space that you have a choice of space in the reception. So if you want a quiet space, you have a choice. But I think the reception area needs to be, again, very clear. And then you move through then into the wards. I think the whole way through your journey, that this connection with the outside and with nature is extremely important. I think that you should always have either a visual or a physical connection with nature. And biophilia is one of the key considerations, whether it's through colour or imagery or an actual view of a garden or a courtyard. It's extremely important, and it has been proven to relax and calm and help with the therapeutic journey.
I think that's one of the things we looked at on Foss Park, wasn't it? That sort of every key interaction with staff members or on your journey, there'd be that view to the outdoor courtyard. Doesn't need to be a huge courtyard, but just that little outdoor space that made you feel calm.
Well, during the building of Foss Park, Ben and I actually walked the journey, and all of the things that we thought were key considerations, we experienced firsthand, and we experienced the connection with nature. We experienced the openness, how the main entrance, how the reception, how the movement then into the ward would feel for a service user. And it was really beneficial for us to actually walk that journey ourselves. I think as a designer, when you're doing something in two dimensions, it's difficult to see the benefits of what you're trying to implement. But I think the benefits were absolutely clear that day, and we have had really superb feedback from Foss Park, from staff and service users. And we've basically tried to create spaces that you can either choose to have interaction and social interaction with other people, or you can choose to have a quiet space for yourself, just to get away from it. Again, the bedrooms, the journey through to your more private space, we felt it was key to always have that connection with outside. We felt it was important to have a single aspect corridor where the bedrooms always have, inside the bedroom, you have a view to a garden, and outside of the bedroom in the corridor, you also have a view to a courtyard.
which is really important. So as you stepped outside the door, you weren't greeted with another service user in front of you or a blank wall. You had that
Yes,
connection to outdoor space.
you had that immediate connection as soon as you left your private space.
Hi, I'm Kath Lake. I'm a director at P+HS Architects, but I'm also a director and vice chair at the Design and Mental Health Network. P+HS Architects have been designing healthcare buildings for 40 years. And for us, designing for healthcare, and particularly mental health care, is about helping people on a journey, helping them feel supported at really challenging times in their lives. And it goes back, that comes down to everything that we do, from the very basics of design all the way through to a completed, finished building. So being here at Design Mental Health is incredibly important to P+HS Architects. It's a fantastic event. It brings together best practice, it brings together new thinking, it gets everybody having a conversation about how we do things better, and then taking on board all experiences. So from a lived experience perspective to manufacturers, all coming together to have great conversations, and then we learn from that and we do better each time we design a new building.
So stakeholder engagement is really key to ensuring a successful design, and that's ensuring that we go through from the very beginning to the end of a project. I think ensuring that we get the right people there is really important, and that there's a wide range of representatives there, from service users and experts by experience. Sometimes their family members can come and offer that visual input as well, through to estates teams, clinicians, occupational therapists. I think there's a whole wide range of needs that need to go into developing these buildings and proposals. One of the key aspects is ensuring that there's a continuity with those people, ensuring that there's a sort of continued timeline of when those decisions were made, to ensure that we get a consistent approach being developed as we're working through the design.
There's also quite a lot of different ways in which we can stakeholder engage, isn't there?
Yeah. So like at Foss Park, one of the initial designs, we did a pin exercise tracking where patients might be at certain points of the day, how their journey would travel throughout the ward, if they'd come off ward, on ward, where staff would be at those points. Would they be in certain meeting rooms at different parts of the day, at handover times, for example? And that allowed us to really test whether those rooms were large enough, whether they were in the right position, so that they weren't having to come too far off ward, ensuring that those relationships really worked well, I think. And that was kind of at one range of the scale, wasn't it? To then looking at AR, VR, using modern technologies, so we can mock up a bedroom, allow a patient to work through it, allow the staff to work through it, see how it works for them, through to pieces of furniture, so reception desks, ensuring that the receptionists and admin team are happy with their setup. I think it's really key.
Yeah. I think sometimes people find it really difficult to visualize space. I mean, we sometimes mark out with masking tape how big a space is actually going to be. But I think with AR and VR, you can put the headset on and you can physically move around the space. So they can take ownership of it. They can sort of test where furniture is going to be, how much space they have, and it's a really important tool.
Definitely. And I think one of the other key things is ensuring that there's the correct time length to get all these engagement sessions undertaken, not only so that we can get the initial feedback, which then allows us time to test those theories, put them into practice, come back to the same stakeholder group, ensuring that there's that continuity there, and allow us to sort of get that second round of feedback, third round of feedback. And it just allows the stakeholders to take a bit more ownership over the plans and make sure it feels like their voice has been listened to, their ideas have been heard, and hopefully take pride in the projects at the end.
And we've done some really important stakeholder engagement with service users as well. That has kind of really benefited to look at it from a different perspective, and things like safety and but privacy as well are very important. So yeah, it is key.
And for colour schemes as well, isn't it? To ensure that they've had that input, artwork,
Yeah.
and there's a whole range. It doesn't just stop once the plan's finished.
Yeah.
It goes all the way through.
Yeah. We have thoroughly enjoyed our visit to Design and Mental Health. It's been inspirational. The workshops have been great, and also finding out about new products, which will make our job a lot easier. So thank you.
Yeah, thank you very much for listening to us. If there's anything that you'd like to learn about more, please do get in touch or visit the website. Thank you.